Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Myself, Dr. Sujit Ghosh from channel Dr. Ghosh Presents. You know, I am doing for last more than 1 year videos on homeopathy. There are 4 different playlists. Homeopathic therapeutics in Bangla, homeopathic therapeutics in English, homeopathic remedy picture in Bangla, homeopathic remedy picture in English. Now actually what I want to say is that you will get about 12 to 1300 videos on this subject. Top 8 homeopathic remedies for aneurysm. What is an aneurysm? An aneurysm is a bulge in an artery. Bulge means swelling actually. Why do aneurysm occur? Aneurysm occur when wall of an artery weakens or the pressure within an artery increases due to some reason. Main culprits are atherosclerosis. In the artery, substances like WBCs, calcium, cholesterol, etc. accumulates on the wall of the artery, making the artery thinner. The luminous artery is minimized. As such, the pressure is increased. High blood pressure and smoking also causes this aneurysm. Deep wounds infection may also cause aneurysm. Congenital cause may also be there. That is caused from birth, by birth. Here, this is cerebral, one of the cerebral aneurysm is shown, and it is cardiac, aortic. Can aneurysm occur in any artery of the body? Yes, they can occur in any artery of the body. Why do we need to know about aneurysm? Why we should know this aneurysm? Aneurysm may cause cerebral stroke, massive hemorrhage, and the consequences may be serious, even life-threatening. But not all aneurysms are so serious. Say, an aneurysm in popliteal artery has little consequence. Actually, aneurysms in this brain and in case of cardiac, it is heart, these are very much important things. What are types of aneurysm? Aortic aneurysm. The aorta means, you know, aorta is the chief artery which comes out of heart, arch-like, in arch-like fashion. The picture is there in the previous. This picture is not here. Actually, it is seen here. If you look this here, this is our heart. This is heart. This arch red arch is called aortic arch. This is the chief artery coming out of heart. Cerebral aneurysm, it occurs in head. Ventricular aneurysm occurs in ventricles of the heart, ventricle of the heart. Popliteal aneurysm, popliteal artery is just behind our knee joint. How aneurysm is diagnosed? Examination of heart, neck, abdomen, backbone, back of knee, checking of blood pressure, ultrasonography of aorta, computerized tomographic scan, that is CT scan, chest, brain, angiogram, magnetic resonance imaging, MRI of aorta, brain. These are so many diagnostic features. I mean, we can adapt any one of these to confirm that aneurysm is there, depending on the situation. So many things are there. You can do CT scan, angiogram, MRI, ultrasonography, anything, even blood pressure. You see, like those things. There is the heart. This is ventricular aneurysm. Ventricle. The ventricle has been enlarged. Here, that's a single artery is showing a bulging. That is aneurysm also. Here also, aorta with large abdominal aneurysm. This is aorta. This aorta start from heart and then it goes behind the artery, behind the heart, just in front of our spinal cord. That portion is showing here, and here a big aneurysm is there in the aorta, large abdominal aneurysm, huge aneurysm is here. What is abdominal aortic aneurysm? Why is it called silent killer? Aorta is the main artery emerging from heart, supplying the blood to whole body, upper half as well as lower half of the body. After the arch of the aorta,
The descending part of the aorta is called abdominal aorta. This is shown in this way. This is abdominal aorta. It is coming from the, here is the lying this possibly arch of the aorta. Here it is lying arch of the aorta. Thereafter this descending. In the descending part, the aneurysm occurs. Aneurysm is often overlooked since it remains symptomless. Since diameter of the aorta, standard diameter of aorta is 3 cm. If the diameter of aneurysm goes above 5 cm, troubles start appearing. That is, between 3 to 5, there may not be any symptoms. Trouble starts appearing like pain in chest, abdomen, lower back and loin regions, that is pain in lower back and difficulty in shortness in breathing, pulsation in belly, cold foot, blue painful toe, low BP, unconsciousness, etc. Often there may not be any symptoms of aneurysm, then sudden bursting of the aorta occurs, leading to fatal symptom. That is why it is called silent killer. Now, what is thumb palm test for aortic aneurysm? This test gives a clue to person of hidden aortic aneurysm. That is, the person without extensive examination, it is difficult to know whether the person is suffering from AA in a person, abdominal aneurysm. So this is a simple test. The person is asked to extend his or her thumb across the palm, open palm as shown in the diagram, this way. If the tip of the thumb crosses the edge of the palm, picture 3, there the tip of the thumb crosses this edge, so he is or she is supposed to have AA, that is positive. Otherwise there is no AA in the person. This is a simple test, but not 100% accuracy, but it is a rule of the thumb. How aneurysm can be prevented? If one has got family history of stroke or heart disease, or for all, the following practices would help a lot in this regard. That is, one who has got family history of stroke, heart, they must practice it. Over and above, anyone can practice this to avoid aneurysm. Avoid sugar, salt, fat. Get enough fresh veggies and fruits. Exercise daily for at least 20-25 minutes. Triple star, most important. Avoid smoking and all addiction, also most important. Have sound sleep. Avoid stress. Do something that gives pure joy. Carbo-veg for aneurysm. That is, we have come to remedies. We have come to the remedies. Aneurysm with blue varicosities. Fine capillary network having a marbled appearance. Pulse irregular, intermittent, frequent. Phosphorus for aneurysm. Small aneurysm with a great deal of throbbing. Spongia for aneurysm. Aneurysm of aorta with dry paroxysmal cough, worse when lying down. Pressure across chest as from a heavy weight, especially at the aortic arch. This is aorta. This is aortic arch. This artery is name of the artery is aorta, chief artery coming out of heart, and this arch is called aortic arch. This arch. Lachesis for aneurysm. Palpitations. Cannot bear little pressure on throat. Must sit up or lie down on right side. Numbness of left arm. Fainting, anxiety. Pulse small, weak, accelerated. Mind the aneurysm is a serious type of disease actually. Plumbum for aneurysm. Chronic endocarditis. The cause of the most common aneurysm. The cause of most aneurysm is endarteritis. Endarteritis means the inner lining of the artery is inflamed. Innermost layer. Pulse 7 to 80, feeble, irregular, can hardly be counted, or may sink to 40. Paralytic weakness of the extremities, hands and feet cold, total want of sweat. Digitalis for aneurysm. Passive congestion of the lungs, owing to weak, dilated heart. Great weakness of chest, cannot bear to talk, pulse small, irregular. Slow when at rest, but accelerated, full and hard when from every motion. Lycopodium for aneurysm. Sensation as if circulation stood still. Sensation as if burning from hot coals between scapulae. These are the scapula bones. This region gives sensation as if burning sensation. Acceleration of pulse with cold face and feet. Barita mur for aneurysm. Complaints of elderly people arising from endarteritis. The same thing, endarteritis, that is inner lining inflammation of the artery. Atheromatous complaints of the arteries. That atheromatous complaint means atheromatous deposition of calcium, WBC, and cholesterol, etc. in the lumen of this artery. That is called atheromatous condition, or deposition, and this deposition reduces the lumen as such pressure is increased, blood pressure is increased. Pulse rapid, full, beating of heart irregular, pulse scarcely perceptible. With this, the video ends. Thanks for listening and viewing.